This is Sophia Lord. She is an 80-year-old retired school teacher who lives in a two-story home. She used to enjoy going to church, but her social interaction has decreased since her husband passed away 6 months ago. Sophia recently had a fall while getting up to use the bathroom, and as a result, fractured her right hip and had to have a right total hip replacement. During the fall, she also fractured her humerus. Prior to her fall, Sophia was independent in all ADLs and IADL activities. She has signs of early dementia and a history of TIA. Her daughter provides assistance with her care.
On the screen, you can see a snapshot of Sophia's continuum of care. She begins in the acute care unit of a hospital, transitions into inpatient rehab, then returns home with home health services. Notice the similarities and differences of focus and approaches within each setting as she progresses in her recovery.
Sophia starts her journey through occupational therapy in the acute care setting. We will discuss Sophia's care during her time in acute care in the hospital. We will be looking at her occupational performance areas of concern, long-term and short-term goals, problems caused by her diagnosis, intervention approaches, frame of reference, applicable evaluation assessments, intervention activities, and service delivery that's applicable to this stage of her care. Sophia's areas of occupational performance that are of concern in this setting are her ADLs, including dressing, transfers, and grooming, to better prepare her for her discharge to inpatient rehab. While in acute care, Sophia's long-term goal is to be discharged to the setting where she will have the most independence. She has 3 short-term goals. The first short-term goal is Sophia will recite 3 out of 3 hip precautions with 2 or less cues before discharge. Sophia's second short-term goal is she will demonstrate using the one-handed sock aid and successfully put on both socks before discharge. The third short-term goal is Sophia will demonstrate independently brushing her teeth and washing her face before discharge in less than 10 minutes. This is a visual of the sock aid that will be used to complete her second short-term goal. Sophia's hip replacement and right humerus fracture have affected many aspects of her life, including performance skills, performance patterns, and client factors. These will be addressed during her acute care. Performance skills affected include her process skills and motor skills, as she has difficulty heeding her hip precautions and walking, bending, and lifting. Sophia's habits and routines have also been affected, as she needs to resist her normal morning routine of showering and dressing as soon as she wakes up. Her routine has been disturbed after her fall. Client factors that have been affected from her fall and early signs of dementia include strength, range of motion, endurance, and global mental functions. The global mental functions include memory and emotional mental function, which have been affected by her dementia. Intervention approaches that will be used with Sophia include adapt modify, as she will adapt her way of dressing by using a sock aid and dressing stick while donning socks and pants and learning a new technique to don her shirt. Another intervention approach is prevention, as Sophia will focus on prevention of hip injury post-surgery by strictly following her hip precautions. The frame of reference chosen for Sophia in the acute care setting is a task-oriented approach. This approach emphasizes an interactive, dynamic process of client factors, context, and environment to promote occupational performance. This frame of reference is great for Sophia's case in acute care, as we are looking at both motor and cognitive deficits. In an acute hospital setting, she is focusing on regaining range of motion and strength while following her hip precautions to prepare for discharge. It is important to focus on the client returning to occupations that are meaningful, such as dressing and grooming, while overcoming deficits, including impaired cognition, while in the acute setting. Assessments that may be used with Sophia in the acute care setting include range of motion, manual muscle testing, and the MOCA. These will help us assess her range of motion and strength after her fall and surgeries. There are 3 intervention activities that Sophia will start with in acute care. which include transferring from her bed to her chair, donning socks, and grooming. For the activity of transferring from her bed to a chair, Sophia will first recite her hip precautions before starting the transfer. The therapist will teach Sophia to perform a sit-to-stand and pivot-turn transfer to move to the chair. The grading will begin with maximum verbal cueing and progress to less verbal cues. The frame of reference rationale for this activity is practicing the functional activity of transferring promotes solutions to motor deficit. As Sophia practices transfers in the context of a bedroom and her hospital room, she is able to overcome cognitive and musculoskeletal deficits. For the activity of donning socks, Sophia will don both of her socks using a one-handed sock aid. For grading, the therapist will provide cues if Sophia is having difficulty remembering the process of donning the sock. If Sophia lacks endurance, the therapist can make the activity easier by starting with one sock versus both socks. The frame of reference rationale for this activity is the functional task of donning socks will help Sophia organize her motor behavior. For the intervention activity of grooming, Sophia will practice brushing her teeth and washing her face with her left hand while standing at the sink in the bathroom in 20 minutes or less. For grading, the therapist can provide setup preparation by putting the toothpaste on the toothbrush. If needed, only perform one of the two activities, washing the face or brushing the teeth. As Sophia becomes more independent, she will complete these tasks independently. The frame of reference rationale is, as Sophia grooms in the bathroom at the hospital, she is able to overcome cognitive and musculoskeletal deficits by using the familiar objects of her toothbrush and washcloth. While in acute care, Sophia will be receiving occupational therapy for 30 minutes each day before discharge. Therapy sessions will take place in Sophia's room as well as in the bathroom.